This is some of our team. We have a team of physios, but also other allied health professionals like occupational therapists, social workers, exercise physiologists, and we work in a group to help support our communities. So our background is about 10 years, or just over 10 years ago, I decided I was going to live a quiet life and move to Oklahoma. It's a great little community, and what we really quickly realised was there was a really shortage of healthcare in the rural sector. And so we now have about 6 physios working there a day, as well as the rest of our team, and they're always booked, always busy. But for us, having exercise classes is super important because we get a lot of people that may come in injured, and they've got injured because they've just had some bad luck and slipped over outside. Or they may have just gradually declined in age and what we call conditioning, balance, and they're just more prone to exercise. So we're treating them, but we're also making sure that we're just not saying you're all better. We're actually trying to integrate them into exercise classes such as what you guys run, their local rest times, but we also have some in-house classes, and it helps transition kind of when they're not quite ready for bigger classes, they need something a little bit more tailored, but also what happens is they like a good chit chat, and sometimes I think they just come for the coffee, which is more than fine as well. That's why I exercise, so I can have coffee and cake. So today's presentation is just a little bit about arthritis and exercise, but we're also happy to answer any questions afterwards or during, just let us know. And any tips or tricks from a physio's perspective that might help you out. But yeah, thank you very much for having us. I'll leave you in Sophia's hands.
Kia ora everyone, my name is Sophia. I'm one of the physios that works alongside Kara. I work in Cambridge, but I have a little bit of experience rurally as well. So I go down to Pew Pew on a Wednesday, and I also run some of our strength and balance classes. So today, very brief introduction about what is arthritis, how it affects us, and how exercise can be of benefit. The presentation isn't super long, so we've got heaps of time for questions at the end, or if you have any during, just give me a yell. If we have extra time, we might do some showing and telling, but we'll see how we go. So we'll get started. So first off, we'll have a little chat about what is arthritis. So there's kind of an overall broad definition of arthritis, and this is a group of conditions that affects joints, causes inflammation, pain, stiffness and swelling. It can affect everyone of all ages, but particularly more common in our older adults. There's a few different types of arthritis. These are the most sort of common. I'm sure you've heard of osteoarthritis, or OA. Most common form, and it involves the damage to the cartilage of any joint. The other type that's quite common, I'm sure you've heard of rheumatoid arthritis. This is an autoimmune condition, so the body is attacking its own joints. There's other forms of arthritis, like gout and so on, but top two are kind of the main two. How does arthritis affect the body? So mainly it causes the damage to the joints. So it causes the cartilage within the joints to break down. This leads to the symptoms, so the pain, stiffness, and then reduction of movement. Over time it affects all sorts of daily activity. Depending on what part of the body has arthritis, you will find that people have different problems with different things. So if we think of lower limb arthritis, they'll often struggle with weight bearing, sit to stands, those sort of thing. If we're looking at upper limb, they'll have problems with all those arm movements, driving, that sort of stuff as well. Impacts on movement. So when our joints have arthritis, they're stiff and they're swollen and they're hard to move. This often leads to a sedentary lifestyle, so there's an awful cycle that goes on. So they have pain, they get stiff, they don't move, it gets worse. So this is why we try to intervene. Common symptoms of arthritis, kind of the same like we've gone over, but just a bullet point. Again, that pain. Sometimes it comes on after movement, or the other type is with that inactivity, so if we've been sedentary for quite a long time. That stiffness, so the joints feeling stiff, commonly happens more in the morning, or again after prolonged rest. we get that swelling, so sometimes the joint looks a bit different. People say that, oh, my knee used to look so different and now it's big and puffy. Reduced movement again, difficulty moving through the range. So some people are really, really stiff and they have trouble moving that full range of motion, something we have to take into consideration. Next, we'll just briefly move on to exercise and how this links with arthritis. So these are kind of the main bullet points of the importance of exercise, especially for people who have arthritis. So it sounds kind of funny because if we're sore, then some people don't want to move, but actually it's one of the best ways to manage arthritis. So regular movement can help in lots of ways. Some of the common ones we have here. Reducing pain. So exercise actually increases the blood supply to the body, helps with that synovial joint fluid, so that's just the fluid within the joints, and this can ease the pain and the stiffness of the arthritic area. It improves flexibility and range of motion, so it keeps that joint mobile, it helps with flexibility. It increases the strength, so if we can get all of those muscles that surround that arthritic joint nice and strong, then they can take the weight bearing instead of the injured joint itself. Helps in boost mood and energy, so as we know, when we exercise we release those endorphins, we're feeling good, feeling happy, really good for our mental health. I think that's sometimes what people don't think of straight away when they think of exercise, but I'm sure all of you have seen the benefits through your classes. It also prevents that deconditioning, so it helps break that bad cycle that we're talking about. Sorry, I don't know if you can see very clearly, but that, sorry, if we just go back that one side. That top picture, kind of the same thing, what we've just talked about, but there's some other things that helps with kind of long chronic conditions. Just general overall health was really good. So lots of different types of exercises are of benefit, and it's quite cool. In the room we have lots of variety of classes, so we can kind of tap into all of you guys. But some of the most helpful ones are the low impact, so really basic, our walking, our swimming, our cycling. These are good because they're easy on the joints, but they still increase our cardiovascular health, so they get that blood flow to the area and they help with that endurance. Other ones which probably a lot of you target is the strength training. So as you can see, we have lots of different ways we can do that. We've got the light weights, we have the resistance, even body weight is great for people who aren't able to lift up those weights. This is really good because, as I was saying before, it strengthens the muscles surrounding the joints. So when the body has to weight bear, those muscles are taking the load instead of through that joint. Range of motion exercises, so sometimes we'll probably start your class with a little bit of some stretches. This is great because it helps maintain that flexibility and the mobility of those stiff joints, and balance as well. So lots of different examples there. Tai Chi, yoga, even just doing balance exercises in your classes. It helps to prevent falls, which is a really important one for everyone in the older population. Improves that coordination, and as we said, crucial for the older adults. That little picture, sorry, down the bottom, that little blue one. Our clinic was lucky enough to do a study with the University of Otago last year with people who have specifically osteoarthritis affecting the knees. This little rating here from 0 to 10 just kind of shows the different levels of exercise. So 0 is your resting, 10 would be your maximum level of exercise. So they were targeting the exercise levels from that 5 to 7. So hard to very hard. Sometimes obviously people aren't able to do that depending on lots of other factors, but it's important to keep that in the back of your mind when you're giving exercises to people. We want to make it a little bit hard so we can improve their strength, we can improve their range, and that sort of thing. Exercise safety tips. Start nice and slow. So if people are new to exercise, we want to start with shorter sessions and gradually increase in the duration. Probably some people go full force and they want to do 100 miles an hour. That actually isn't super helpful in a few things. Means that they might not come back, they might not enjoy it, it might flare up the osteoarthritis, all of those things. Focus on form. So it's really important that when we're doing our exercises, we're doing it properly. So to prevent injury of other places, or if we flare up that way again. So this is where you guys come in and people in your class can talk to you and make sure that we're doing them in a proper way. Listening to our body is really important. So it's normal to feel some pain, especially with people who have arthritis. But if it stops you from being able to sleep, if you get increased fatigue, if it's really sore the next day, these are key things to look out for. Might mean that we just need to reduce the exercise. This little picture down the bottom, hopefully you can see it, the top bar is people without osteoarthritis. So that green area is pain-free use of a part of the body. That orange zone is it's going to be sore, but it's still safe to do the exercise. That red zone is where we're going to be sore and it's causing harm to the body. That lower level is people who have osteoarthritis. So you can see the difference. That green area, that pain-free use of the joint is a lot smaller. That orange zone though is way bigger. So all that's really telling us is that people who have arthritis are going to get sore a lot quicker than people who don't. But that doesn't mean that they should stop. Just means that they might be a little bit more uncomfortable, but they should still be moving, which is really important. Here's just some real life benefits of exercise for arthritis. So, as we've said, it improves their mobility. People report after they do consistent exercise that it helps reduce pain and it gets better movement in the joints. Studies have shown that regular exercise can lower the pain levels and kind of helps reduce people's need for medication. The other one is just generally it gives people a better quality of life. So if they exercise, they have stronger muscles, they have more movement. This means that they can do things more independently, they can do activities that they're wanting to do, helps with their overall health. The other thing that's quite important that we didn't add up on here is the balance aspect. So if we can make people's balance a lot better, that can reduce the risk of falls, which reduces the risk of injuries. Just some other additional tips. So if we're thinking of arthritis as a whole, exercise is very important, but there's lots of other things that can be helpful that we can inform people about as well. Diet and weight management is good, so it reduces the stress on the joints, especially those weight-bearing joints, so what we talked about, those hips, those knees and those ankles. Staying hydrated is really important, especially if we're exercising, so making sure that we take lots of water to our glass. Water helps to keep the joints lubricated and reduces the stiffness in arthritis. Other thing that you can tell people that they could try at home after your class is some heat or ice therapy. So using a hot pack or a cold compress before after exercise can help manage that pain and reduce the inflammation. That's all, very brief, but we have heaps of time for questions. So if anyone has anything they would like to ask us, doesn't necessarily have to be about what we talked about, anything about physios and exercise, feel free to fire away. Yes?
Should they avoid it if they've got an rheumatoid flare?
I think that's just individual to each person. So often when they have a rheumatoid flare, they'll be feeling pretty rubbish. So I think it's just working within what they can manage. I think being a little bit active is good, but not sitting on their chair and not doing much. We work really closely with the rheumatologist, so if someone has a big flare and it's not settling within their normal management and stuff, we can contact those rheumatologists. Their rheumatologists are really good. They'll often reply to an email from us within a couple of days, which all the nurses are like, amazing. Yeah, but I think some movement's better than none, just within their
organization. You tell them to come down and just mix with class and balls or something, but not the whole time.
Exactly, because we do strength and balance, or any class or any group activity is a little bit about exercise and a lot about all the other benefits. So keep people coming, and we can, and you'll all be doing this anyway. But you know, we can modify activity to whatever level someone's at. So you can have someone, standing, somebody sitting, all doing some good stuff.
Is diet and nutrition something that's talked about with your groups?
Yeah, so we're not experts nutritionists at all, but we definitely know weight management's really important. But we also get some people that a little bit of weight on is probably good. So we will direct them through their GPs to be able to access some dietitian support or other agencies depending on what they need, but it does make a really big difference. And there's probably, there's a lot of research, or what we all know, certain foods help inflammation. There might be some rural practitioners that can help guide some people around anti-inflammatory type natural medicine, or other cultural groups will have some as well. So there's lots of different thoughts around that, but definitely for us, we're not experts apart from get moving. I'm quite happy to say, look, if we lose a little bit of weight, that might help, but that's more experienced. I don't expect my younger staff to say that, but I'm happy to, because I could.
Do you have a referral process?
Into our programs?
Yeah, or into your physios and that? Is that got to go through GP? Or
No, they can come through us, and we do a screen, a safety screen at the beginning, and we sit down with them and just talk about what they're doing. We also do some testing throughout the program. Usually it's when we don't have one here today, but we've got we have students throughout the year from the universities, so they're really good at doing testing, gives them some really good practice, so we're having those regular catch-ups. But if we feel, especially in the community, if it's not led by a health professional and you don't feel safe, I'm not sure what the recommendations are, but it's good to get clearance from the GP. There's challenges getting to the GP. So it's just kind of that common sense, but we often have someone feeling a bit yuck, or they turn up and they're dizzy, and every day we're checking in with our clients to say, how's everyone today, rah-de-rah. But our receptionist staff, we're lucky. I applaud you all for running classes in community places, because it's just, we have that extra layer of safety that we always have at least, more than one person on site, at least a couple of physios, there's probably someone else, and a receptionist, and a medical centre next door. Yeah.
Question, how many times a week, or over how many weeks does somebody attend your program?
A lot of ours are just ongoing.
Is it ongoing?
Yep, so ours...
How many times a week would you normally recommend?
Oh, look, I think it's what people can justify with time and afford. There's a lot more lower, we don't make no money. I don't run a very good business. We have actual stuff we do, and then we have stuff we do because it's important for our communities. So ours are about $7, I think, a class, but I know there's a lot more in here. Some of them are $2, $3. So, if people can be doing, we try and set them up so they can do the stuff at home, so it's safe, but the more people can do, the better. If we could get everyone in probably twice a week would be great. Once a week's better than nothing. Some of the ladies literally have really way busier social lives than I do. So, we might see them once every month. So for us, it's just an ongoing thing, and we just have some breaks in the holidays. We also mix up our instructors a bit. So our students have some opportunities to learn some of the stuff and lead. Because teaching in a group is a lot different than one-on-one, and so we want to give them those skills, and it mixes the classes up so that they don't get bored with the same person all the time, which is pretty good. And also, how we target our classes is really different. So what we're doing in Cambridge, we have nice pretty dumbbells. In other places I can have milk bottles, but it doesn't really fly in Cambridge probably. Whereas down, Te Kuiti, we're doing more Māori-based stuff, more rākau, might be using waiata and different things. So we're trying to target it to the group that we're working with. Yeah. Pardon?
Do you do a regular body's capacity screening?
Yeah, we do a test. So based off, if anyone's worked in aged care, they have some balance assessments, like the Berg balance test, which is a series of tests where how can you get up from a chair? Is it you can do it by yourself or with help? How can you turn a corner? There's one called a timed up and go, so we're measuring how fast they walk and if they're safe, turning left and turning right. So we're doing that throughout the year. And they love it, eh? Like, they really like knowing that they're no worse. But a lot of people get better, you know, and so that's really cool.
Is this once every 3 months? Or
Oh, if we could do it every term would be beneficial, but we usually use our students, which we usually have 3 times a year. So it's usually around 3 times, because it's good for them to, and by the time, you know, if we've got 10, you know, 6 to 10 people in a class and we've got 6 plus 8 classes going, it takes them a bit of time. Yeah. We can send it to you, yeah. Yeah, but they're just something, it could be anything you test, like how many times can someone get in and out of the chair without using their hands? That's a really simple one, and they might be able to do it 3 times, but at the end of a group of 10 sessions, if they could do it 5 times, that's a massive win. Yeah. So we'll send out some ideas of different ways to do it. Yeah.
None of your slides are talking about pain. How far do you go with the pain barrier? What do you
Well,
people suggest?
everyone's pain barrier is different, so this is what makes it really interesting. So, yeah, so there's lots of schools of thought here. So we're going to have a group in society who think that any pain's bad. Okay, so they are always the ones that will just come occasionally to your classes, and then you'll have the others. But we usually say if they sit around a 3 of out of 10 pain day to day, that maybe they could just increase it by up to 2 points, so up to 5. Then they want to settle down by the next day, is usually, or you can do it that they shouldn't go above 5. It kind of just depends on your population, but then we'll definitely have some ethnic groups that 0 pain, they won't do anything without 0 pain. So we're doing a little bit of work in that space. We're very lucky, we have a really diverse international group of staff, and so if we crack some of those troublesome populations, we'll let you know. But yeah, so that's what I usually say, 1 or 2, but no worse by the next day. Yeah. But lots of rest, like sometimes I walk in and the staff are working them really hard, and actually they're just as happy to have a chit chat. So you got to read the room a little bit, have good rest, lots of water, chat about, I don't know, whatever's happening in the world. Just gives them that time to recover. But pain's fine. There's a really amazing study, we will send it to our webpage. It's called, we do quite a bit of research with Otago Uni. This is a shoulder study we're involved in. It's called, I'll have to send you the link, but it's Otago Shoulder Study. Yeah, website, but I'll send you the link, and it's about shoulders, and then there's a whole section on pain, but it's an amazing resource that's access to everybody. They haven't locked it down just for the study. It's got amazing real world, how we can all explain it to ourselves, to patients, videos, and some really cool videos on why pain is okay. And that's a great resource to share, so we'll send that to you all. Giza won't mind us sharing it. Yeah. Yeah.
Explain to people that you only go so far.
Yeah. Yeah, and pain is fine. And what we saw in the kneecap shoulder study in OA knees is that we all think OA is limiting. You hear it, people don't want to exercise, they just want the knee replacement or the hip replacement. But what we actually have seen, and we know from experience, that if we get them in the early stage and keep people active, we're actually going to prevent a lot of that. And when our healthcare dollar is not going to stretch, we need to have these alternative programs. So there's that study. We're also doing one in shoulders at the moment, looking at does traditional physio, where you come once a week for 4 or 5 sessions, better than just education alone. And we're setting them up and having access to that resource, and hey, go and just do some exercise. I think the issue is people's perceived value of physio is that they need your hands on them, but actually the outcomes are probably the same. So a way to stretch our healthcare dollar more, especially in the rural sector where we are, where we've got patients coming 2 hours to physio. We can do it differently.
Can you be more specific about what level of pain is okay?
Usually around that, like I wouldn't be going above kind of 5 out of 10.
So they assess their pain level themselves?
Yeah, it is, yeah, that's the problem.
So up to 5?
Or you can say 2 points higher. So I have some patients come in and they wander in and they could do a handstand and jump up and down, but they've got 9 out of 10 pain. Or 8 out of 10 pain. Whereas I know that's not how I would perceive it. But I think for you guys, it's just a matter of acknowledging their pain. And if you're concerned, hey, it would be really great if you could see your GP or your physio just to check that this program, that they're happy for you to do it. 9 times out of 10 will say yes. Yeah.
So, do we suggest to folk that maybe if they do have a bit of pain, they take some painkillers before they come to class?
We cannot prescribe medication, so it's outside our scope as physios. So how we get around it is we say, hey, it'd be really great if you could talk to the pharmacist or your GP about some options.
Even paracetamol?
Yeah, we can't even say that. No, so it's outside our scope as we're non-prescribers, yeah.
The way I see it is that it's better to take the painkillers and get the exercise.
Yeah, there's just our elderly population just have so many other medical conditions. Yeah. And so we'd hate to be, just telling them something. So to keep ourselves safe, that's in our profession, that's our rule. I work in with sports teams. I can't even give anyone a Panadol, without having a whole process. So it's just something ethically you need to just think about, but my advice would be to direct them to their GP. I agree, but you can use heat packs. We know exercise helps with pain, but yeah, we just can't say that.
To me, the older generation also, they've been brought up, no, I don't need painkillers, no, I can manage.
Yeah. Look, there's lots of ways and lots of, it's just other medical conditions we need to just take into consideration. Yeah.
Differentiate between joint pain and muscle pain?
Yeah, so I say, when you were young and you went to rugby training or netball training or run a marathon and you went to your first training session and you couldn't walk, that pain's okay. Okay? But if you've got pain that's keeping you awake at night and it's worse the next morning, you've probably just done just a little bit too much. So that's how I'd explain it. I keep telling myself, I went for a water ski on Saturday, I only can walk today, so I keep telling myself it was okay pain. I didn't need to see the physio, I just needed to get a bit tougher. But yeah, that's how we kind of explain it.
So it's better to burn the muscles.
Yeah, burning muscles just means you've done some work.
So that was another thing. I often say with pain, if it's a sharp pain, that usually is an indicator of.
And I think if I put every pain word into a box, it's pretty big. And we have really noticed, having an international staff, how wide those pain words are. So you might have heard of words that hurt. Okay, so we don't really talk about pain in our profession because there's some people that pain is like a danger word, or and that makes them not do anything. So we talk about function. So how's things going? How was hanging out the washing today? Could you play with your great grandkids? Could you, go out for coffee? And we use a bit more of that. So it won't matter as long as they know what you're thinking. But there's words that hurt that we try and avoid because we just dig in ourselves a hole to get out of. So we try and just use function a little bit more. Yeah. The only other thing that I was just thinking of is encourage good footwear. It's not too bad, but good footwear. We're really lucky. A lot of people that are more advanced in their balance, that's not quite as good, are really hesitant to use walkers and walking sticks. But it's that prevention space that if we can prevent them falling over, we're actually probably ahead of the game, keeping them out of ACC's books or rest homes and stuff like that. So we know once someone's had a fall and broken their femur, which is the most common thing we see as you age, your bone density decreases. If we're having a fractured femur, the long-term ability to become independent reduces significantly. So we see a massive go into respite, rest homes, or their life expectancies reduced. So, encouraging walkers and sticks, you can get them through your GPs, some physio clinics where we're registered to order them through DHB, so we can get them like lolly water into the communities if we need to. So talk to your local physios, some of them might be, but otherwise the GPs can get the community team to do it. But they come pretty much overnight. But also there's an abundance of them in the community. So, we have them like kind of stashed in a magic cupboard.
You talked about footwear. What about how much difference is there to having bare feet to the exercises? Are you using more natural?
I think the people we're seeing are often at the more end stage of their balance journey. So a lot of it's what can they get on easily and safely. Bare feet's great. I think we teach all of our young people balancing exercises with shoes on and shoes off, different surfaces, because the longer we can keep balance good, the better our job is. And it's more what someone's comfortable with. If they can't bend down to put their shoes on, they're going to fall over, so we're better to be in bare feet. But it doesn't matter too much, I don't think, in our population. Yeah.
I think since you bought some gear,
Oh yeah.
we don't have too much time, but
No.
we really need to. And I was just out with Belinda, sorry, but I just caught the end of a question about medication. I guess from my point of view, thinking about our boundaries as leaders is to, I think like you said as well, just to not go into conversations about medications at all, because you're stepping beyond your role as a fitness person.
Yeah. People complain way more as well. Like the pre-COVID, people never complained about a service or a class or anything, but now, people are always, those things are, if something happens, they're always looking about the community, what's happening, and we get requests from the coroner for things that we might have said, we're one person in a journey of 20 people, and they'll look at our notes still. So, not that it ever comes to anything, but we write notes about our classes and stuff, whereas I'm not sure what you guys do. But anyway, the best place, there's lots of cool places to get fun things, okay? Exercise classes are about variety, probably. Kmart, okay, is one of the best things. So a lot of our stuff is just from Kmart. So, like throwing, you probably all do these anyway, but like throwing games are good. But you could be doing the one with the round points, petanque, throwing bead bags into different, objects. Sitting and standing, okay? Balloons are good. We didn't have any balloons here today, but batting balloons around your group. These are like kids balancing things. I've had these for 5 or 6 years, and they're still fine. So we have kids jumping on them. We don't necessarily get our strength and balance classes standing on them, but we might use them as obstacle courses. Oh, you'll be surprised what they try and do, eh? And that's why I worry about community classes, you guys are amazing, because I stress out what if I'm in a clinic. But you can make obstacle courses, okay, with different objects. They've got long ones, or you might see hurdles, but you don't need this kind of stuff, sticks from the garden, climbing over them, maybe by a wall so no one falls over.
I saw a really cool one the other day. but they were on one leg and then trying to balance the ball on the plate. That's quite cool.
There's lots and lots of like Instagram, Facebook pages of balance. Kids ones are really good, like kids pediatric occupational therapy ones. They've got the coolest stuff, way cooler than we have. We steal a lot of that.
Just like a throw and a catch. It's quite good with the band.
If you've got scarves,
scarves.
you know how you got thousands of scarves in your cupboard? They're really good. So we run a Parkinson's class, and if you're ever bored and in Cambridge, at what day?
Thursday,
at
2 o'clock.
2 o'clock, come along. I don't know how Sophia runs it every week. She must be so fit. But they work on really high intensity, fast exercise. But they're doing heaps of catching and stuff and standing. Same with our MS patients. So but scarves are good.
How long is the session?
About 45 minutes.
Yeah.
Gives us 5 minutes of chit chat. Usually we try and wrap it up in an hour, and then they go off to the cafe. But by the time someone's late, so about 45 minutes with lots of breaks. But if we've got some really high-risk clients, they're a lot smaller classes. A real high-risk group would have 4 max, and they'd be doing lots of sitting exercises, and then the others would be sitting doing something while one person's doing some standing. So it's real one-on-one type stuff. So they're still that time, but we don't achieve, it's a lot more spread out. Yeah.
That's a good segue into some other activities.
Yeah, there's so many. It's like you need to do like a show and tell around everyone's classes.
Who would like to receive a small gift from us? Thank you all for
Have to do that. But thank you for having us, and we'll get this sent out with our details. And any questions, don't hesitate to email the clinic. If there's any way we can help, we're often around the neighbourhood and happy to pop in and say hi. So we're just about keeping our community safe and keeping them out of physio. We're really happy then. Excellent. Thank you.
Thank you. Lovely to have you sharing. So